So, Monte with Geek Rehab, I'm going to show you some. I'm going to show you a product here. There it is. This is the Kinesio S3 scooter. All right, see, Kinesio mobility scooter. It's got a lot of different options it can do. Okay, drop this down, drop that down. So, all right. So we got a mobility scooter here that I'm really impressed with, that we've talked about in the past. And I want to just show you some of the ways how it operates. And it really works out well. I'm going to give you a little tutorial on it. So I'm going to turn this camera back to the machine itself. So we got you here. It's really nice how it talks to you. It's got several different speeds. Okay. Actually, got to turn the key on first. Okay. It sings a little song to you. For instance, if I'm not sitting down completely, it's got a red sign there. Take the seat before driving. All right, did you hear that? It won't go without me sitting down. So now that goes clear, and now we can move. Taking a little cruise, all right. That's only not too fast, about 2 miles an hour. Put that puppy up to medium. Now I want you to let me know how the quality is on this video. If anybody can chime in on here and let me know how the quality of if you can see okay, if you can hear me okay as well. All right, let's go back to cruising on the scooter. This is a Kinesio scooter. All right, here we go. We're in the medium range, hitting over 2, going to 4. All right, so it goes turning the corners a little bit slower. All right, on the straight, 4 miles an hour. All right, let's slow that down a little bit. Let's go to high speed. All right, we're going crazy now. Going ballistic, coming in hot. All right, let's see. Tommy Firm says, why is it daytime where you are? Because it is 7:30 in the evening in northern Idaho. All right, so let's see. We're hitting high. All right, good on brakes. I think we get, so a low is 2 miles an hour, medium's 4, and high is 25 miles an hour. So now I need to go back up because I'm about to run into the bush.
Reversing. Caution, please.
All right. Hello to Swami. Hello.
Reversing. Caution, please.
There we go. Hello to everybody that's coming in. Let me know where you're viewing in from. I'm interested in see where you're where you're at. It's daylight here, 7:30 evening, but what's it like there? Where are you guys at? All right, so now it also has a horn. All right, fancy dancy. Got a little headlight. Okay, push the headlight button there. And I'll show you. There's the headlight down there. You may not be able to see the difference. Let me turn it off. Okay, there it's off. There it's on. Okay. Now, one cool thing about this. All right, there's my Aunt Mary viewing in from Rockford, Illinois. Thank you. All right. To let you know where we're viewing in from, we are in northern Idaho. All right. This thing has a nice.
Hold the throttle lever to walk the cart and release to stop.
Did you hear that? Let's go back to it. Okay. It won't repeat for me. Say it, hold the lever and pull to walk. And so I'm not sitting in it now. I'm just walking with it. And I'm not having to push it. It's doing most of the work. I'm giving a little bit of effort to it, and that's it. Let me see if it goes backwards for me too. Yeah, it does. All right. So that's pretty cool. This is one of the few mobility carts I've seen that you can just walk with it. All right. It does most of the work for you to move it around. It's very easy and very controllable. It also lays down really nice too. All right. Let's see if I can do this one-handed. There's a lever under here. Right here that I'm pulling. And the whole thing, the whole seat drops. Okay. Just to kind of show you that. And this drops the handle, drops like that. So that is really collapsible. If you look on our YouTube site, Geeked Rehab, I believe we've got a nice visual of this, and it's in a link for us also. Thanks, thanks, Mary. I like my transportation too, although it's not safe on the highway. But it's good on some altered terrain as well. We've tested that out. But we've got a link for this as well if anybody's interested in checking it out for purchasing from the main company. All right, so it's really nice. It really fits, very compact. All right, it's very light to lift. Okay, see that? Okay, and there's another lift from the back, but let's go back to putting this back together so we can do a little cruising. There, got the seat up. Okay, we're gonna go cruise around a little bit. Let me stick this puppy in high.
Dangerous road condition. Please dismount and walk the cart.
Dangerous road condition, that's a new one. Okay, let's put it in medium. Let's see. I don't know what it detects as a dangerous road condition.
Reversing. Caution, please.
All right.
Reversing. Caution,
There
please.
we go. It's a lot of safety features on this.
Reversing. Caution, please.
So sometimes it's too smart for your own good. All right. There we go. So let me bring it through a door.
Reversing. Caution, please.
So I got one individual said cameraman is bad. So yeah, sorry. Thanks for the honesty. All right, so it goes through a doorway pretty easily. Goes into a clinic pretty easily. So
Reversing. Caution, please.
All right. So if you've got an individual that needs to get into a clinic, it's very easy to move around, to get into tight spaces. All right, and sits very well. So that's the Pyseek Mobility Scooter S3. I think it's really good product. I just want to bring that to your attention. If you're interested, we've got a link to it that you can find. All right, so let's bring it back to the bad cameraman's face. And yeah, let's see if we can hook that back up. All right, so we've got a few more products. I want to say hello to everybody that's chiming in. Thank you for joining us. So on our Geeked Rehab Shopify site, let's see, that just went, oh, there we go. On our Geeked Rehab Shopify site, oh, Misty Green, you asked how much this is. I think you have to look at the link.
I think it's at
1200.
Adjust the price intermittently.
Okay, so did you hear that? Hopefully the price is kind of adjusted off and on, but right now we think it's being advertised by the Pyseek company for 1200. All right, so some of our other products on our Geeked Rehab Shopify store is some of our handy dandy packaging labels here. We've got 3 suction cups. All right, we use these in therapy. All right, even comes labeled Geeked Rehab, everything rehab. All right, we use these to help with, you can help with blood circulation, help with contractures. All right, and basically muscle soreness. All right, you want to increase the blood flow to an area, so you put it on the area, and it sucks right on there. Okay, it's got to be a fairly flat area. Okay, see, there we go. If it's like an angle or something, it's not going to stick. All right, you've got to have a fairly flat spot. All right, so now that pulls pretty well. And oh yeah, the added benefit on these, you can also use some gel. all right, to help. And thank you, Mary, for letting me know the cameraman is okay. And also, we had other people asking how much the Piseek mobility scooter is. We think it's about $1,200. Check out the link. It'll take you right to the Piseek site, and you can look at the price and where it's going for now. So also, you know, these are on the site. They're, like I said, good if you have an injury, athletic injury, any kind of other surgical thing they're trying to get over once the wound is healed. You need to work on scar tissue mobility or whatnot. You can put it on the site and just kind of use it to help mobilize the skin. Okay, move it around, give some suction to help with reducing the scar tissue.
Does that work on the bald head?
It does pretty well on the bald head. I've had an individual that wanted to be a unicorn, so they stuck it on there and they left it on there for quite a while, and now I look like an alien. I should use this as a Halloween costume. All right, now, oh, and it sticks pretty well. See, now if you leave it on very long, it'll make it really nice and red. So now let's see, I'm looking, oh, okay, Michelle, you've asked, hi, what is it? These are suction cups. We use these in therapy a lot, all right, to help improve blood flow, decrease scar tissue formation, all right, and it helps in many other options, okay? So you can look at that. So next thing I want to thank you for the laugh on putting them on my head. And we aim to please and entertain. Okay, some of the other products in our store. So we are Geeked Rehab. A lot of our videos initially started off and specializing in kinesiology taping. All right, we've kind of branched out from that to everything therapy. All right, or anything you're interested in that's therapy related. So we've gone on that. But going back to our original purpose of forming the channel is tape. All right, this is called Kinesiology Tape. And so these are also on our channel on our Shopify, as well as these super awesome scissors. All right, these are the best, and I'm not just saying this because you can get it from our store. Literally, these are the best scissors. I have stocked every clinic that I work in with these scissors for anything that requires cutting. They work really good with the tape. You can probably, I think I've tried 8-layer cutting, at least 8 layers of this tape. You want to see how good they are? All right, let's see. So let's do the test. The only thing you got to watch out for is cutting your fingers. Okay, so let's see. Let me see if I can, how much I can fold this up. So it's 2, 3, 4, 5, 6, 7, 8, 9. All right, thank you. Yeah, I got it. First thing to see is the plungers on my head. I like actually scrolling, then I saw the bald, and went, yeah, this guy is what I'll watch more than 5 minutes. Okay, so what you basically want to do is that person just wants to see me talk every night and just keep this on my head and see how red I can get it, right? All right, so now they do suck pretty well. I mean, they don't suck. They suction really well. All right, so how many layers did I get there? 1, 2, 3, 4, 5, 6, 7, 8, 9 layers. All right, 9 layers of tape. And these are Tape Geeks brand scissors. All right, this is 9 layers. Let's see how it cuts. Piece of cake. No problem at all. So that was awesome. All right, I tell you, these scissors are great. All right. Yeah, I'm telling you, these scissors are fantastic. Use them for anything you need. All right. And they go for a long time. Don't cut casting material with them. I did that. They're not meant for that. All right, they doled out pretty quick. But tape, they'll cut all day with the tape. All right, look at that. I'm just making a mess at this point in time. So
9 layers at a time.
9 layers at a time. All right. So they will go a long time, cutting tape, cutting paper, all kinds of sort of stuff. All right. So those are awesome scissors. I believe they are, well, let me see. Yes, stainless steel. All right. They're not going to rust. All right. Stainless steel. That's why they're so good. Okay.
Should I ship that on the bald head now?
Hey, this matches my my shirt.
No, like a mohawk.
Should we make it a happy face? And then we got 2 eyes and a happy face. How happy can you get now? Hang on.
It's gonna be marked something.
Man, I hope I never run for any political office because this would just be really embarrassing. At this point in time, nobody's going to take me serious after this. You know, the other thing with tape, you can make your own hairstyle. All right.
Let's do an airbender.
Airbender. That's right. All right. So another couple things, rollators. All right, we got some foam things to help with massage. We got a small one. All right. They're by Volga. Okay. And they come with carrying cases. This is the mini. You know, you can. I like this one. It has a nice soft but pointed edge to it. All right. So I love this person. Basic fan. Hairbender. You got to control your hair first. You got to have hair first to control. So anyways, these are good foam products for massage. They're not super duper so solid that they just give you muscle soreness and cramp. I've been on those. These are really good. I've been on some of those solid ones that really hurt your IT band when you roll back and forth. These are a little more forgiving. They'll still get the job done, but they are more forgiving. So you can roll up and down with them on your IT band you roll that down on the side of your leg here. Okay, you're rolling on the ground on them. All right, you can just put them on your back against the wall. Roll up and down like that with them. They feel good on the ground, rolling back and forth, rolling on the ground on your back of your leg, your hamstrings, rolling on your stomach for the quads. All right. Again, this is a nice miniature size with a little pointed edge. The larger one is this bad boy here. Okay. Another nice carrying case. Okay. For same purposes, just a larger. This one feels a little more firm as well. So it may depend on what you need this for. All right, it can help you with that. Okay. I like the comments. Thank you very much. Just reading some of the comments. All right. Oh, yeah, comments a lot from the basic SCP fan. So where are you coming in from, basic fan? Love the comments. And these, again, Volga makes them. I think it's a very good product. This has a little more firmness to it than the smaller one. All right, you can see the size difference. Okay. So, and then for the little miniature guys, here you go. Look at that. Little mini me. All right. Now this one, there's a purpose for all of these, just depending on what your need is. But I really like this little guy. All right. For your bottom of your foot. All right. If anybody's got plantar fasciitis, this little guy is seriously great. All right. You just roll it back and forth. Okay. On the bottom of your foot, it gets some really good, serious tension release. All right. I got Kevin coming in from Costa Rica. Oh, Kevin, I was just in Costa Rica. I was there last year in the beginning of December. It like rained for a month, like the day before I got there. So they said it was a great time to be there. That was awesome. Thank you, Kevin, for letting me know. Another one, Wolf asked, does it come with lubricant? I'm assuming you're talking about the suction cups. No, it doesn't come with lubricant. But what kind have we
We
found?
can link some ultrasound. What we like to use is ultrasound gel.
Ultrasound gel has been what
Lotion
we've
works.
used them both. Whatever kind of lotion also is good. Ultrasound gel is just, it has a little more lubricant stickiness. It's water based, so it cleans up really easy and nice without any residue. Okay. And Michelle, scar on your wrist from my surgery. So depending upon the location of the wrist, if you can get something that, depending on the size of it, to suction on that, yeah, it's probably a good idea to get some of that scar tissue released. All right. I've used it a lot on, but again, it's got to kind of suction on that wrist. So it does work well with that. The lotion, it helps it stick also, but if you're going to go back to talking about these, if you're going to kind of suction it on you and then you need to move it, okay, to really stretch that scar tissue out and to get other areas of scar tissue, the lubricant is a must. All right, so that stuff really works well. All right, when you're moving it around. Otherwise, it just sticks in place. All right. So again, the Volga miniature one it works really well for plantar fasciitis. Okay. If you have, let me bring this screen down a little bit. You got tennis elbow right here. That would be a fantastic thing for this. Okay. Golfer's elbow, whatever. Just for these smaller regions where the tendons are a little lower, in smaller areas, okay? But particularly plantar fasciitis, I found this works phenomenally. All right, so, okay, Wolf, good suggestion. Thank you for the shout out on this guy for carpal tunnel. Okay, good idea. Just a nice forearm massage. All right, absolutely. Mikey09, baby oil. That would work. That would work for those suction cups as well. So that's not a bad suggestion. Baby oil is a good idea. Let me scroll up, see if other comments here regarding those. Ultrasound gel can be used. Yep, for lots of things. All right, let's see. Is that the same as a suction cup? Well, it depends on the suction cup probably, because you can't move all the suction cups around in a line because some of them have sharp edges. All right, so they can damage your skin. All right, thank you for listening. Content, Michelle, to answer about your scar tissue and the suction cups. Does it hurt? It can be uncomfortable, but you can control that depending upon how much you move it, how much suction there is. That's really helps. It depends on how the pain is, how long you leave it on there. Again, is also one of the factors, because it will really draw blood up to that surface, and it will leave it red or purple, and that's not a bad thing. It just lasts for a while. All right, so but scar tissue breakdown, it can hurt. It definitely, I won't lie to you. Depending on how you do it, this is one of the ways that I found that out of several ways to do it, this is one of the least painful ways. Okay, scraping is another way. Very effective, but quite painful. Okay, yeah. It seems like the most effective ways are the most painful, but I found the suction cups give you a little more ease on how on the pain level. Okay. All right. Let's see. Looking at
on our shop.
yes. All right. Some of these comments I'm not mentioning because they're not appropriate for the channel. Okay. So we're going to watch that. Okay. Okay. India's chiming in. Thank you. I appreciate the support from India. We got a lot of supporters on our channel in India. Thank you very much. All right. Carpal tunnel surgery soon. This is from Slide Encounter. Getting carpal tunnel surgery soon. Is it worth it? My reading is mild. If my EMG reading is mild. So what I would typically do on that, not having known your history or your amount of symptomology on that, your neurologist will help you in determining that for the EMG reading. If you've had physical therapy, they should probably chime in on that as well. I would also try therapy before surgery. Okay, there's many alternatives to helping carpal tunnel. Physical therapy has a lot of different avenues. I also do dry needling, and that's been beneficial for carpal tunnel. Okay, so I wouldn't advise jumping right into surgery. Try physical therapy first, acupuncture, dry needling, things like that. All right, there's a lot of other modalities that can be used before you do surgery. All right, all right, all right. Thank you, listening content. I appreciate your that I'm cute. And I look like Johnny Sins. I believe I've been told that before.
There's lots of comments on videos.
There are.
I had to look that up.
I'm not sure about that. Okay. All right, looking through. All right, let's see if there's any others. Topic, Kirsten. All right, what's the topic for what I'm talking about? Well, we went over a lot of things. We're going over some products in our Geeked Rehab Shopify store. We looked over this product here. Let me, where'd it go? This one. All right, we looked over this product here. I went outside, cruised around on this Pyseek mobility chair. Great for people that have mobility issues and a difficult time getting around. Okay, went over some rolling foam, things that we needed, some kinesiology tape, basically products that are in our Geeked Rehab Shopify store, just to give you a kind of a window shopping capability here. All right, you can go to our site, go to our store. There's also links on here for some of these products. Okay, so thank you for asking, Kirsten. Let's see. How old can the scar be to use suction cups? How old is too old to work on it? All right, that's a really good question. A is for ama de casa. So the scar, what I would say, it needs to, basically the wound needs to be healed. All right, absolutely needs to be healed, closed, no drainage, and probably a couple of weeks after that, just to make sure you do not rupture the wound bed, all right, or the incision. How old is too old? That's a very good question. I honestly never give up. I never say die. It's worth a try. All right, you're not going to make it any worse by trying to break it up. All right, so it's always worth an effort, always worth a try to do it. Okay. Anything for the back, especially low back. Yes. So I like these Volgas. All right, for the low back. You can so you can either get on the floor to do this, or you can put it behind your back. And if I had, let's see, let me turn it. Basically, if the wall was here and you're going back and forth on the wall, let's see. I was right here. There you go. Okay. And you're just going back and forth on the wall right there. All right. Just trying to massage it. That really lean in. You can put a lot more pressure on it. It does feel good. It's probably a little harder on the floor than right here. You got to have some decently strong strength in your legs to kind of go back and forth. You can also rotate on it a little bit. Okay. So the center part of this, right here, you can see is indented. Great place for the center of the spine. Okay, the spinous process to go in. So it's not putting any pressure right on that spinous process, that bony part. And these humps right here feel great on the paraspinals, the muscles right along the side of the spine. They really kind of dig in and give a good massage. Okay.
We also have some core and some stretching channel videos that I did for the back.
Very good question. Very good comment. If you go to our site, Geeked Rehab on YouTube, we've got some videos on low back stretches, low back exercises. You can look through all the different categories and look under low back. Okay. So those are excellent to look at, good resources. Oh yeah, TENS unit. You probably have heard about that if you got chronic low back. We've got a fantastic TENS unit. I've got one at my house. It's the one of choice that I prefer. That's actually a very inexpensive product. That helps with pain. Okay. And just look at our channel and those videos. Let's see. Michelle, you asked just because I have a very severe my wrist. I have carpal tunnel surgery done on it twice, and then I broke it, so they had to go back in and do it again, and we fixed the break. Man, Michelle, you need to switch wrists. That's a lot on one. Wow. Maybe you had carpal tunnel on both wrists, I'm assuming, but then you broke it. So yeah, you've probably got a lot of scar tissue there. So that's definitely worth working out the scar tissue, because you got scar tissue forming in that carpal tunnel. You can it can develop all over again. So you need to keep that broken up. Let's see. I haven't tried dry needling yet, so thank you. I'll try it. Yes, give it a shot. I do it in my clinic for patients, and I think it is a beneficial thing for dry needling if you're not afraid of needles. Okay. How old am I? That's a good question. In the mornings I feel older than I am. When I'm with other people, I feel younger. So let me ask you. Let me let you guess.
Yeah.
All right. Guess my age. Okay.
Don't hurt my feelings.
Yeah. Don't worry. You won't hurt my. Well, I don't know. Don't worry. Won't hurt my feelings. My kids are very. Kids speak the truth, and so yeah. Guess my age. All right. There you go.
There's some stuff that Michelle could use.
Oh yeah, Michelle. All right, what? How about cervical spine radiculopathy? All right, that's a good question. Can dry needling help for lower back? Absolutely. Yeah, I have done. We'll have to talk about dry needling some more. I have done dry needling on low back, cervical pain, cervicogenic headaches, TMJ. You name it. Dry needling has a place throughout the body. It helps with radiculopathy. I've used it for radiculopathy. You need the electric stimulation hooked up to the dry needling for the most beneficial effects, especially for radiculopathy. All right.
If you'd like to make some comments on what else they'd like us to cover for videos or lives.
Yeah. Okay. So good question. Let's leave comments. Let us know what you would like us to come back with, either on our Geeked Rehab videos or live videos. It sounds like dry needling is a popular question or topic. Products you're interested in. Okay. So hi to Guli. Hey, I'm sorry, I'm not going to even try your last name. I don't want to offend you. I've got some individuals asking me for dance for money. I do like to. Well, let's see. Do I have where they can drop money down? No, yeah, you got to drop some money in there, but I'm not sure I'm going to dance tonight. I didn't bring my dance shoes, but thank you for asking. I do like to dance. All right.
Next time.
Yeah, maybe next time. Slide and counter. The cat and cow seems to work very well for stretch on low back and mobility. Absolutely. Also, I'm not going to demonstrate it right now unless you include that as a dance for 500. The wag the tail. All right. So same position you're doing the cat and cow in, all right? You can wag the tail, all right? So that gets some lateral mobility as well. So good comment. I appreciate that exercise very much. Let's see. I'm a dentist and I sit and work for long hours. Any exercises for me? Yes. All right. Let's say hello to Azim and Hinalatha. Sorry if I did not do justice to your name. As a dentist, sitting for long hours. So let me know what part of your body, is it your wrists, is it your shoulders, is it your neck, that really seems to give you the issues being a dentist? Is it your low back? All right. Sitting for those long periods of time. I know you can get into some weird positions for long periods of time. So follow that question up and let me know what position or what parts of your body are the achingness, and I'll get back to you on that. I can also do a video on that as well directly to you. All right. Hello, Frank Romero. All right. Well, I got some bids here, man. Where's you throwing money down here? Meritus, Mr. Nice Guy. Man, I don't know if that's for dancing or what. Cupping is very good on back pain. Okay, thank you. Yes, I agree. The cupping using these does help relieve back pain, does help relieve pain. Okay. There's a lot of uses of these cups. So go to our channel, look on the Spotify on E3, Shopify, Spotify.
Same thing.
Sorry. Yeah, we don't play music. But Shopify for those. Okay.
Spotify for the dancing.
Yeah. It depends on the music. Michelle also always in severe pain. So it sounds like you've definitely got some wrist issues there. So
Check out our paraffin.
you should also, I did a video on paraffin wax bath.
We don't have the full length, the short right now, but we'll get the full length out.
Okay, so we got a short video on the paraffin wax bath. We'll put the longer version on soon. Paraffin, if you get that paraffin wax up into your wrist, to your hands, your fingers, that heat, that deep moist heat really does help give some relief. All right. Sagar Kumar, hello. Thank you for chiming in here. Where am I from? Where are you from? I'm from Las Vegas. Right now, I'm in Idaho. Where are you from, Sagar? All right. Okay. So neck and low back. All right. From our dentist friend. So yeah, I can definitely understand the neck discomfort. I am surprised by some of my dentists, what they have to go through and the positions they're in for so long. So I've done some videos on neck stretches. Okay. Go look at that on Geeked Rehab. So some really good neck stretches and some strengthening exercises as well for that. That was early on in our videoing days, but the truth holds true no matter how long it lasts. On there some chin tucks, okay, just going like that. So if you're in the precarious positions that dentists are in, oftentimes you're definitely going to get probably some forward head posturing, tightness in the upper cervical spine, lengthening in the lower cervical spine, and maybe some instability. So those chin tucks really help. So check out that video under the cervical spine or neck on chin tucks and neck stretches. Okay, and you're welcome. So let's see, Rick. Shout out to you, Rick Velasquez. I got 4 herniated discs, 9 through 12, rehabbed it, feels fine. Question is, will they eventually rupture? So a lot of times when rupture, herniation, bulging, those terms are oftentimes used synonymously, okay? It just depends on the degree of herniation, bulge, or rupture, okay? Those all kind of mean the similar thing. It just, again, depends on the degree of it. And no, it doesn't mean that they will eventually, I would say, get worse, all right? They can re-herniate, they can re-bulge, re-rupture. Again, they're all synonymous terms. You've just got to keep your core, all right, tight, conditioned, low back muscles conditioned, and be careful on how you're lifting and using. Obviously, sometimes some people bend over to pick up a pencil or a paper clip off the floor, and that's the straw that broke the camel's back. So, not, you just got to think about it and keep everything in your mind of how you're doing things. Michelle, let's see, your last comment was about having cancer, your back hurt all over. That's why I'm in severe pain. That does seem severe, not just your wrists. You've got a lot of other issues going on. And so with those kind of conditions, there are some things to help with pain modulation, particularly the TENS unit that we talked about. But some of these conditions cannot be treated with therapy, unfortunately. The aquatic, yeah, aquatic therapy. All right, pool therapy, doing those. All right. Let's see. Any other questions? All right, I think we're kind of down to the end of the questions. So, hello, thank you for chiming in from everywhere you were, from around the United States and from India. Appreciate you chiming on this. We're gonna probably sign off on this right now. But
interested in learning more about BFR.
So I want one last caveat to the live. So BFR cuffs, blood flow restriction cuffs. Has anybody ever heard of them? Let me know if you're interested in learning more about these. Okay, we've got this product here that's available, and other BFR cuffs are out there. There's tons of them. But let me know if you're interested in learning these. Send us a shout out. Good night, Aunt Mary. I love you as well. Thanks for tuning in. I always appreciate your support. And thank you, Michelle from Texas. Again, any other information, any other comments or suggestions that you want to learn about, let us know. Go to our channel and we'll bring that to you. Love to help anybody else out, any rehab related questions. So, all right, this is Dr. Monte. Timing out. Thanks.